segue right into this thing. We have Dr. Marc Cesari in here, chiropractor. Why don't you go ahead and introduce yourself, Marc, to our viewers and members?
Sure. My name is Marc Cesari. Been a chiropractor for about 16, 17 years. I would say that probably there's not much difference between me and a decent manual and a good manual therapist, and just try to get people out of pain, improve their range of motion, and get them to do what they want to do. So I've had the pleasure of being at Towson University at the college level for about 10 years and playing well in the sandbox with strength coaches and athletic trainers. I've worked in a practice for somebody for about 14 years. I've gone on my own and for about 3 or 4 years and learned that business model. And then I've had my hands from some professional athletes to the PGA Tour. And just what I try and do is bring sports therapy concepts to normal everyday people and get them moving faster, or get them healing faster and doing stuff and get them to do what they want to do.
What would you say to any of our members that are like, chiropractor, isn't that like voodoo stuff and alignment? And then if you get hurt again and you don't see me what do you say to people that ask that?
I think in the chiropractic world, we don't come from a good group of people. It's not really difficult to get into school. So the chiropractors you get on the other end, you get some phenomenal ones, and then you get some that choose a business model versus a healthcare model. And I think sometimes in healthcare, we determine our healthcare by the business model. And you might have in the chiropractic world a lot of technicians and a lot of people that don't care and administer really good health when it's needed. You're going to get better with some chiropractic work, but I think physical therapy is really important. Strength and conditioning is really important. I think a good healthcare practitioner knows how to administer the right treatments to the right situation.
How do you do all that with respecting your lane? Because I know you've heard it, and Fernando Kier's famous for saying it, right? Stay in your lane, rugby guy. But how do you do that a good job while still staying in your lane, in your opinion?
I think you do it with intention. I feel where I fit is if you come in with a problem, if you're not broken, you don't need to see an orthopedist or your primary care doctor. But then also you might have you have a personal trainer that you work with that knows something's not right in the system, but they can't train you the way they want to. So who do you go see? If you come to a good PT or a good chiro that knows how to evaluate movement and quality movement or aberrant movement and administer chiropractic care, dry needling, soft tissue work, physical therapy, maybe just the right strength and conditioning to give you a better body, I think that's a great lane to be in.
How do you evaluate movement?
I like the foundations of a function, the basis of what a functional movement screen was meant to be. And then what's called the selective functional movement assessment, which is the clinical sister to the functional movement systems and screen. Making sure the person moves well. And do they have independent joint range of motion and soft tissues to absorb the load and position and put and make a change to it? And then, if you're in a sport, like if you evaluate track people, you see runners all the time. That's a movement screen to itself. So bringing in a basic foundational movement screen or system that you can go with to make sure the joints move well and soft tissues move well and they have control of it. And then figure out, are you a golfer? Are you a javelin thrower? And looking at those screens and things and movement assessments, and then determining that's a movement screen to itself. When you put that together, you're establishing getting that person to do basic functional movements that they need to do in life. And then you're taking the next step and going, what can't you do? And what do you want to do? If you're Mrs. Smith that's 80 that just wants to walk, that's really easy to do. But if you want to be a javelin person and throw the javelin and you can't, we got to give you a body to do that.
What is the difference between the SFMA and any of the FRC principles? Because, you said you work at Towson, so that's how you and I know each other. What's what would be the difference for any lay person or any young practitioner listening to our conversation?
I think SFMA does a good standard system that allows you to do this algorithm. and figure out where the person has an issue. So for someone that doesn't understand it, they can go through this algorithm and determine, do you have a hip that doesn't move well? And then I think the FRC, or the functional range system principles, in my interpretation, gives you a little more freedom. They say, can this hip move well? These are all the ranges that you need to get to. And they're not as specific in some of those aspects where there's no algorithm, but they are specific in looking at the nuances of a hip and going through the entire range and making sure that you can tackle what you need to. So they give you the freedom of that. So I think both are great. You just got to find a system that works, constantly build upon that, and don't stay just satisfied.
How do you balance that and, you know, being a jack of all trades? Because you talked about like chiro, physical therapy, good strength and conditioning background, and dry needling, and you do all of them. How do you do them all well? Where, you know, they talk about, if you have breadth, you don't have depth, but how do you make sure you get enough depth and breadth to do what you're doing in your own private practice?
I think it's like, there's a book called The One Thing, and it's what's the one thing that you want to do to make everything else better. So as a strength and conditioning coach, maybe you see 7 things that are going on that aren't quite right for that person to get to those positions to do stuff as an athlete. You pick and choose what's the one thing that's going to affect all 5 or 7 of those most effectively. So I take that approach in my world of, what's the one thing that's going to address all of this? Is it dry needling to get that person to move better? Soft tissue work? We're trying to make one stimulus, and then we're going to work off of that. If we do manual therapy and dry needling, and it's going to do the same thing, it can make you worse. So it's administering one thing and then removing something to get you to move better, and then work off of that. So it's really picking 1 or 2 things at a time. It's not picking everything, but it's knowing how you administer each tool in your toolkit appropriately.
Keeping everybody an N of 1 and understanding that you do. How do you go about, like, what is typically the first thing that you go after? Again, you've been doing it for so long. Like, what is the first thing in your funnel? Like, all right, we're going to start here because 85% of my people I've dealt with, we're going to start here.
Mm-hmm. I look at them and go, all right, it's really in the history of what can't you do? And are you broken? Are you banged up? Or are we going for performance enhancement? So if you're broken, you really can't move to the basic lifestyles or general physical life. So let's get you moving better. Then if you're banged up, that person comes in and goes, I can do everything. I just can't do this one thing. And then you really try and figure out what that one bias is, or where that one issue is, and tackle that. Because if we clear that one thing out, they're going to get a better body to load the system and perform. And then it's performance enhancement. Well, if I decrease your pain, improve your range of motion, you're going to get better potential output. So that person comes in and goes, I can't, I'm good at running until mile 10 of my run, and then I start to fatigue out. And that's a conditioning capacity standpoint. So, what was the question again?
Where do you usually look to start? If somebody comes in and they're like, hey, I can't do X. And if your answer is like, hey, you know, man, it truly depends on the individual. I got to put them on the table and see what they can or can't do. Mm-hmm. That's fine too. But like, what are your usual, hey, I'm going to start here based off my funnel of 16 years of practice.
Yeah. So I manually, we're in this society where we're trying to veer away from touch. I want to be able to put my hands on someone. There's some therapeutic intangibles with that. A lot of it seems like PT and chiro professions in those professions, they want to go to dry needling, but there's some quality of putting your hands on someone as the tissues move and joints move and see what it feels like. So in my world, that's where I start, because that's something that not everybody's doing, or we're veering away from it. So I get them on the table and say, can we passively get to ranges? And then go to the next tier of stuff like that, and then doing strength training or putting load to the system or something like that.
Have you found more often than not it's structural, so skeletal, muscular, or nervous system that has been the limiting factor when you talked about the 3 different people: broken, pain, or sports performance? Which has been the one more often than not that you found with any of your clientele?
I think the nervous system is the grand regulator, and there's so much we don't know about it. And if your nervous system is on a hypersensitive, in a heightened sense of awareness, you're going to be in fight or flight mode, and the body will do stuff in a different way. So there's receptors in your joints we're finding now, in your fascial system, in the capsule. So they're constantly receiving feedback. Your muscular system just doesn't work. That's receiving input. So the grand regulator is your nervous system that's receiving all this input and then processing it. I mean, we've all seen somebody who, like if you see a cat that's on fight or flight, they're constantly shrugged up. There are people that are depressed or anxiety, they're constantly worried about stuff. They're always in that cat mode. So you can see that.
Yeah, sorry to jump in. It just reminds me of a case where one of our guys has a little pain, and that inhibiting pain affects like body function elsewhere. So the moment like he's had like a groin, groin's really complicated, but like he had like this nerve blocking injections, and then suddenly, even though there's been no structural change, then the other stuff starts releasing because the body's like not sort of like braced for pain anymore. So everything else just sort of goes back into harmony without being invasive, without like moving or activating. It's just like overworked. So it's funny how that releases, just like that fight or flight you were saying, like being prepared for pain all the time. So you just don't want to move.
Mm-hmm. And let's say somebody, like one of your athletes, has a hip that's not working right, and you work on them. Sometimes you can't determine what their nervous system is like or their personality. So you treat their hip 2 or 3 times, you don't see a change. Then you realize they're a nervous Nelly, and then you start working on their nervous system, and everything relaxes, and all of a sudden they get better. So they actually had a hip, but you just administer something to the nervous system.
What do you typically do for that?
Oh, that's where
asking for a friend.
Yeah, right, exactly. You change your gear. I mean, you have to know, like, know your audience and assess the room and see what we're dealing with. I might deliberately throw somebody on needles because they need to chill out for 20 minutes before we start working on them, because they can't shut down. So you put them on needles in a nice room with some heat and some music, let them chill out. And then it becomes a lot easier to do soft tissue work.
Has it been that way with you for your whole, profession, or were you kind of a more like, because you are very, I mean, our listeners have been hearing you for the last 15 minutes, and you are very laid back and calm, and that's a fantastic quality to have. Have you been that way your entire life? Kind of talk about that over your 16-year career, where you started, and if you're ever looking back, like, oof, what was I doing back then?
Yeah, I've had, I think, a bunch of great mentors, from people I've worked for to clinicians that I've overseen. And then I always strive to be better. I'm sure you guys do as well. And then looking at good role models, and just trying to, we all get wound up in some way or another, but in the room, I have to bring my best person that day. We don't have our best days, but it's been probably one of my deficiencies that I've worked at it hard, to just, okay, let's tap into this person, even though I'm having a bad day. How do I take all that personal stuff away and go in and treat the person? Because patients can feel that. If you don't have a good day, your game's not on. So it's been a work in progress, and I want to get better at it. That's one of those things I want to get better with, because when times are hot and someone needs to really feel better and they're stressed out, they're just opening up to you. It's how do you go, all right, this is what I think we're going to do today. Does that person really need needles? No, but they probably do from a different aspect.
What made you decide to go on your own business after working for other people for a period of time?
I just wasn't ready to own my own business. I didn't know the nuances of it. And then at one point, I think I had some really good ideas, and you have to make a choice. Do you want to make your own decisions? Do you want to be your own office manager? And I was ready to tackle it. I might have been a late bloomer doing that, but it's been fun. I don't have to worry about the trade as much anymore. I have to learn now the business model. So it just depends on, do you want to start off and not know anything about business and how to clinically treat and throw that all together? Or I went through an associate. I didn't have much responsibility. I worked on my own trade and task of what I do, and now I'm bringing in the business model. So it's been a fun journey. It's just been off from what a lot of people do, and I've had the ability to do that.
You could speak about that, because we have, a lot of our members and listeners and clientele are, private sector coaches, and the founder of Strength Coach Network here has done a ton and worked on his business model. What have been some of the best things you did, worst things you did, and things you plan on learning from in the future?
Best, worst, and plan. The best thing I've done is like really analyze yourself and figure out what your deficiencies are and work off of that. So reading some books, try and read a book once a month, once every 2 months, to help you grow and be a better person, and work on your deficiencies. So like the one thing, or the tipping point, or the purple cow. So those are some of the best things that I think you could do, is constantly learn with that. And I'm 16 years out. I'm constantly taking continuing education courses that push me to the next step, and constantly learning about that. And the more everybody talks about it, the more you know, the more you don't know. Yes.
Oh,
And I'm
ain't
just
that the
trying to,
truth, right?
yeah,
Oof.
just trying to work on my trade. Go ahead.
I was gonna say, how about things that you're planning on doing because you're like, this didn't work. Like, let me make sure I never do that again.
Oh boy, things that don't work. I'll have to think about that. I mean, there's a lot of stuff that probably doesn't work. I don't know. We got to go into something else right now.
That's fine.
Oh, you know what I do? You know what doesn't work is when you get somebody worse. That sucks, and you learn from that. So only get somebody worse once or twice, but don't have the same pattern of it.
How do you keep that client then?
Oh, just be compassionate and just say, look, I screwed up. That was not my intention. And just be honest with them and say, I'm going to do everything that I can to try to rectify the situation. And then, like, unfortunately, but thankfully, I fractured somebody's rib a couple months ago. It was a woman that I've treated for a while, and it was just a weird situation. And I was doing a mobilization on her, was really light. And I felt this, I just went into an abyss, and I felt a weird pop. And she's like, oh my God, that hurt. I was like, oh boy. And she sat up. I said, let's sit up for a second. I think I just broke your rib. She's like, no. I'm like, yeah, I think I probably did, but we have a choice. This is what we should probably do. I'm not worried about it. And I just checked up on her. And she's like, well, everything was great. I felt great from the visit the next morning, but my ribs probably fractured, So she's like, she came in next week, no problem. But, those things happen. That you learn from those. It makes me think, okay, what do I need to do next time?
Wow.
So, yeah.
Wow. Like when we started, I was thinking like the title of the podcast is going to be like, you cannot have like enough enemies, stuff like that. But no, you just broke someone's rib and she didn't leave.
Yeah.
Which makes me think of like a hostage situation, like your mind games with your patients or whatever. No, but seriously, like that's like a level game of like accountability and ownership, isn't it? Like,
yeah. Well, and that's a great situation. But then, okay, thinking of worse things is learning from your experiences when I was younger, might have been a little hot, and you start getting a little confident and a little too cocky about stuff, and you have your good days, and you get someone worse, and they don't come back, and that's tough. That's tough to swallow. And then you just learn from it. It wasn't my intention, no, but you go, all right, how do we? That holds on. You hold on to that for a while, and then you just try and change your way and go, you know what, we got to treat, those are situations that become stressful. How do you become a better clinician and make better decisions? So when those situations come up, you can cut it off at the pass and be compassionate about it and not be a dickhead.
You mentioned it in the beginning, and you have the golf stuff in your practice. Talk about what you do for the PGA Tour and how that goes, because we had the British version of William Whalen, so a strength and conditioning coach, from what they do. What exactly do you do when you're on the tour with the PGA Tour? So
the PGA Tour has a fitness trailer and a performance trailer. A physical therapy trailer. And the fitness trailer has some athletic trainers in there. They give you programs. They make sure the athletes are, and that's where the athletes work out. They warm up, they do their stuff. And then there's the physical therapy trailer. So each week they have two physical therapists and one chiropractor. And we're there for therapy, whether that's improve their range of motion, decrease their pain, and just get them to do stuff. So once again, sometimes they're broken, sometimes they're banged up, and sometimes they just want to feel good. So you figure out which hat you want to wear, and then we're there at the discretion for the players. There's one chiropractor that asks 25 of us to work. So we do about 2 or 3 events a year, and we're subcontracted. We're not affiliated directly with the PGA, and you just play well in the sandbox. You do your job, right? It's a team when it's out there. It's one of the weirdest sports where like each individual player is their own team, and you do your job that week. You don't try and you need to come see me. It's like, get the person moving, get them to play. Can they go that week? Awesome. And then you figure out which hat you wear. So it's a great experience.
Do they have to book, like an hour with you? And then when our conversation with Wayland, he said that they're typically there for days 1 and 2 of a 4-day event. Are you guys there all 4, just days 1 and 2, hour session, 30-minute sessions? How does it go with any of that stuff?
Contracted with the PGA on the trailers.
Yep.
You're there an hour and a half. So events start Thursday and they go till Sunday.
Yep. So
you're there an hour and a half before the first tee time on Thursday. And then you're there till probably 7 o'clock at night when sundown. So, but you start Tuesday, which is a practice round, and then Wednesday is typically a pro-am. Yep. So those guys use that as a practice round. They might be working on stuff from the previous week, or they slept the wrong way and they banged up their neck or their low back and they can't move. So that's the way that works. And then the players just come in. You don't know what you're going to get. You might see 5 people in one day. You might see 25. So that's Tuesday, Wednesday. And then when Thursday hits, they go in waves. So you have tee times that go from, let's say, 6 a.m. till about 9 o'clock. And that puts all the players out. And then you have a second wave that comes in from 12 to 3, and then they go out. So it's staggered. So you kind of know who you're going to treat and how much time you have to work with them.
So, I mean, say somebody is listening to this right now, like, okay, what this guy does, this is really, really freaking cool. Mm-hmm. What path did you take? How does one do what you're doing?
I think it's a combination of a few things. If it's taking the approach of everything I spoke about, of being passionate about what you do, having a good clinical evaluation mindset where you're efficient, and then just tackling seminars and things to improve what you do. And then the second component is relationship building. It's who you know. And if you just constantly are a good person and you know the right people and you form relationships, just bump into the right person at the right time and you grab the opportunity. And that's what happened with the PGA. I saw a seminar that allowed me to possibly get onto the PGA. I think I came in with a good skill set, and it just meshed together. So it's creating the right opportunity.
How about in terms of, pure education? Because here at Strength Coach Network, we've talked ad nauseum about how the strength and conditioning, university major needs to be overhauled. If somebody wants to be a strength and conditioning coach, they either have to get a bachelor's and now a master's degree in exercise science or something related. What's the path for somebody to become a chiropractor?
I think you need a 4-year undergraduate degree, and then you can apply for chiropractic school and get right in.
What does that process usually look like? How long does that take?
Chiropractic school is 3 1/3 years, I think. It's consistent with no summers off. So it's equivalent to a 5-year program.
Oh, wow.
Yeah. And it's a great education. It just depends on what we do with it. But you get at least in my school, a full year of cadaver work. You get a great solid evaluation process. By the time you're done, you can give a really good 45-minute exam, because you might be in the state of Washington where you're a first portal of entry, and you might be the only doctor in an area that you have to do an evaluation on somebody. And so you might have to do a lung exam or a heart exam and figure out what's wrong.
Whoa.
Yeah. So that education is great. What we do with it afterwards is, I think, challenge. But if I had to redo it, I mean, physical therapy is a great program. If I had to redo it, I might go to athletic training school because I admire some of their skill sets of being able to tape an ankle. I love their ability to assess the situation and triage work on the sidelines. That's something I just don't have a skill set with. I could have gone down that road in the chiropractic world, but I just wanted to be part of a team. I didn't want to be a jack of all trades in that aspect.
You teed up a question here for me. How do you see chiropractors fitting in the high performance setting? You know, again, we've talked about this at Strength Coach Network a lot. High performance, you know, where it's not silos, and it's typically everybody says, you know, strength and conditioning, athletic training, nutrition, sport, and I guess you would say chiropractors don't have their own silo or area within the high performance network. They're supposed to be lumped in with the athletic trainers. Should they not? And if so, why? Because I know my opinion on it.
I think it's our job to probably, at least the way I think about it, I put chiros and PTs very similar together, just based on their training. Give you a better body, decrease your pain, improve your range of motion, and then figure out where to go from there. So in the sports world, then I want to give that athlete, like, to somebody like you, to then load the system and give it a better Formula One car.
Now, you again teed up the question perfectly. How quickly after, because going back to the FMS principles, you know, after you get that joint range of motion, you're supposed to move right away. So you have that integrity, you have the neural capability to actually own that range of motion. How quickly after a session with you should people, or maybe not just a session with you, but time with you, whether it's a extensive or intensive session, how quickly should they go through movement patterns and load themselves to now own that umbrella, for lack of a better term, to move better without getting hurt?
I don't think we know. Look, so let's say you come in and you have back pain, and the only thing that triggers it is sitting. You're like, I can work out and do whatever I want. It just hurts to sit. If we work on you and remove the protective guarding thing that you have that's caused from sitting, if you don't poke the bear and irritate it, do you need to load it right away afterwards when you feel good? You already feel good. And then if you don't irritate it 3 or 4 hours later, and you want to go to the gym and you don't have an issue, you know, you can do it whenever you want, just as long as you don't poke the bear. Now, if there's a deficiency and you want to prime something or get it activated, sure, you can go right to the gym and start doing some stuff. But if you go sit the wrong way and that triggered it, did all that priming and stuff right away help out? You might have just poked the bear again. So it doesn't help.
How often? No, that does. How often of poking the bear do you see it being some sort of disc herniation, either forward or backwards?
I think disc herniations are probably more common, the most common thing that comes into everybody's clinic with back pain. So I think Robin McKenzie's book talks about, who's a physical therapist, that you do McKenzie exercises. At least my interpretation of what I read from that book is the back is categorized in 3 different things. It's a derangement, which is a disc issue. I think a dysfunctional thing, which is like a gymnast or a football player that does extension stuff and they end range load and piss off a joint, like a facet joint, or it's a muscle spasm, which is something acute. Or no, it's postural syndrome, which is I sit for a while and I load my spine. I get an irritation from posture. So postural syndrome is you sit for a long period of time, you irritate it. Okay, that's easy to address. That's not really a major condition, but a disc issue can be debilitating. And then the dysfunctional pattern of a facet joint or a hyperextension from loading on a regular basis is more of the history of constant volume and irritating it. So I see disc issues, I think, all the time in my experience.
Without giving away your secret sauce, what do you do / what do you recommend to our listeners in terms of how to handle that? And then how to, I know we can't prevent injuries, but what are some good trends and good training that you've seen over your time to help that happen less often?
Looking at every back issue typically has a movement bias. So figuring out, just take your life and figure out what are the triggers. That's what I ask in a history. That's what any good clinician should ask, is how do we irritate it? Because if your back doesn't bother you to, let's take a typical patient that has a disc issue. It might or might not hurt to cough and sneeze. They often don't like to sit, but they do better with standing. So those are things you look at and you try and find their movement bias. So that person's often going to have trouble with leaning forward and they'll feel good leaning backwards. So if you find those triggers and you stay away from those triggers, you're going to feel better. And then I think the body wants to heal. So if you avoid those triggers, the body will want to heal, and it does a pretty good job. So really what I do is I intervene and just break it down and figure out what are the things that provoke it, educate you on how not to, and then treat you, do some soft tissue. This is the way I think about it. Do some soft tissue work, do some joint work. Let's get some blood flow to the system, which brings oxygen. Let's decrease the protective tone from you irritating it. And then I teach you how you were probably irritating it. So if I work on you, you get a better range of motion, you get decreased pain, then you don't poke the bear. And now we stack together a couple of days where we're not irritating it. I think the body does a good job of healing if it's not broken.
How do you not poke the bear if, like you said, it's gymnastics or football where they're required to do it, or it occurs so often in their sport?
Then I think it's having good relationships, like with somebody like you, and then saying, all right, the only recipe for overtraining or over volume is just to decrease it, and just have a discussion with the right parties and say, look, I can work on make you feel good, but this person keeps coming back with the same thing. And there's a history of they hurt their back always when they squat. Well, something's wrong in their squat. So then we have to talk with the strength coach and say, look, how can we still accomplish the task of making gains, but not irritating that? And that's just my approach.
Another saying that I've heard you say, in addition to don't poke the bear, is playing well in the sandbox. How do you recommend to our listeners out there, based off of your experience, how have you been able to play in the sandbox well with other people and other professionals to have the experiences that you've had over your career?
It's being at the university level and just having that experience of sports medicine, athletic trainer, strength coach, physical therapist, chiropractor, the athlete, and the head coach maybe, and knowing that everybody wants the program to succeed. And it's taking a step back and go, okay, how can I work together as a team and make that athlete a better athlete the next day? And just put your ego aside. And we all have something to learn from everyone. That's why I've spent years in the gym at Towson University. I like to work out, but I also want to learn from you guys. One of my deficiencies going into school or coming out of school, we didn't have a great skill set for physical therapy. So I spent some time taking what's called a diplomate in the physical therapy in rehab. And then I see rehab and performance is so intertwined. I wanted to see it from your standpoint of performance and getting good relationships with you guys so we could have an honest discussion about it. And then learn from the athletic trainers, pick the brains of the sports med docs, seeing what it's like to see fractures or rule out certain things. It takes time.
How one of the things that athletic trainers have talked about in the past is the fact that, like you said, okay, even maybe progressions, regressions don't get taught as well, and periodization is periodizing and planning, your sessions as a chiropractor. Is that something that is typically done, or how does it go about on the day-to-day when somebody's coming in? You talk about the breakdown with the SFMA. What is the process like in terms of, okay, this is where we're at today, we're moving to this, based off of truly the day that they come in, and you have to just adjust on the fly, or how does that work?
It really comes in when that patient comes in. I don't know how they're going to present that day. So if I've seen them once or twice and their range is better, their pain is decreased, there are things that frequently triggers it or less, we're getting better. So depending on where they are, so we'll do a quick movement assessment, figure out their pain, figure out where they have troubles, and then determine what we're going to do there. If they have all those things, we migrate to something else. We might just do stuff in the gym in the office and just do rehab stuff or performance or priming.
Will you do anything that's objective in terms of, range of motion testing, or is everything subjective with you?
I think there's room for error. What's that? I have trouble saying it. Interreliable.
Inter-rater repeatability, reliability?
One of those. Yep,
Yeah.
exactly. So I look for quality movement. Can you get to end range? There's a trigger in the middle of the range. And I don't specifically measure it, but we've seen, if you see someone bend over, what good quality movement looks like and bad quality movement. And once you get to know the patient a couple visits, what their movement is. If it's acceptable, great. I'm not worried about that. If it's not, then I have to determine based on what they want to do we have to give them access to something that they don't have? Do we have to get better hamstring flexibility mobility? And then you kind of pick and choose.
What's the difference between mobility and flexibility to you?
Based on what I've read and interpreted, flexibility is just the range that a tissue and a joint will allow to passively go. Mobility is how much your brain can control it.
I would agree. I feel like I teed that one up on my
simple. Yeah,
exactly. I appreciate you taking the time to talk with us today. If there's
Thank you.
anything else that you're like, hey, you know what, I really wanted to go in and make sure that we mentioned this, but he didn't ask me this. Is there anything where you're like, I really want to get this message out there to strength and conditioning coaches, like stop doing X, or you should, blah, blah, blah.
No, I mean, this is a great opportunity. I guess what I want to say is that there's great PTs, there's great chiros, there's amazing strength coaches, there's amazing athletic trainers. Just figure out the ones that play well in the sandbox if you want to be a part of a program, and have that network of people that you trust, and communicate well. So, yeah.
Where can any of our listeners and members follow you along with what you're doing?
Good question. I'm not a huge social media person, but you can go to baltimoresportsclinic.com and check out our website and hunt me down on the social media stuff. I don't know all my handles and stuff like that. I'm not into that too much, but yeah.
We'll get you going on that. Thank you very much for taking the time.
You're welcome.
Thank you very much, Mark.
Thanks, guys.
Congratulations on making it to the end of the video. Why don't you celebrate by watching more videos just like it? You can also help us on our quest to placate the algorithm gods by liking, sharing, subscribing, and commenting. Thank you.